Good morning, viewers. I am Dr. Anuj Kumar Patel. I am a general and a laparoscopic surgeon from basic to advanced laparoscopy, presently at TX Group of Hospitals, Banjara Hills, Opal, Kachiguda. So today we are going to talk about laparoscopic surgery, which is my field of specialty. So we should understand first what is laparoscopic surgery, what is the how is it different from an open surgery, what are the other names for laparoscopic surgery, and what are the types of surgeries which are done in a laparoscopic surgery at our center. So what is laparoscopic surgery? Basically, it was an era where open surgery dominated over laparoscopic surgery years back. With the advent of newer techniques, instrumentation, the OT availability, the anesthesia, cart machines, and the energy devices like harmonic, covidian, the ligature, as well as the harmonic devices, there is a transition from open surgery to laparoscopic and robotic surgeries. So you should understand what is a laparoscopic surgery. Laparoscopic surgery is nothing but it's a keyhole surgery or a minimal access surgery. Minimal access surgery is to access the different quadrants of the abdomen or the different areas of the abdomen through small holes or keyholes. So essentially, one should understand that a laparoscopic surgery can be divided into basic laparoscopic surgery to advanced laparoscopic surgery. So what is a basic laparoscopic surgery is with it includes diagnostic laparoscopy to a basic laparoscopic appendectomy to a gallbladder surgery or laparoscopic cholecystectomy. Now, as the transition has occurred, it has been there is a paradigm shift in doing the gastrointestinal surgeries and cancer surgeries with a laparoscopic approach. So, once coming to the laparoscopic surgeries, you should understand that it is done under general anesthesia, as and it is done with 3 holes, 4 holes, or 5 holes. These are called as the minimal access ports. So those ports are placed generally one using a the optical trocar or with the open technique or a closed technique, 5 to 10 centimeters above the umbilicus or below the umbilicus. So it can be um, above the umbilicus or below the umbilicus using a 5 or a 10 camera scope, and based on the access of different organs to be assessed, those are into right side or left side of the main port. So that is called as a triangulation, wherein the ergonomics is better to operate on a patient so that the hand movements are focused at the organ. So, what are the different types of laparoscopic surgeries we perform? So, the basic surgeries are laparoscopic appendectomies, to laparoscopic cholecystectomies, to diagnostic laparoscopies to diagnose GI conditions or gynecologic conditions. Uh, Coming to advanced laparoscopic surgery is performed in our operation theater for surgeries which include whole of gastrointestinal tract, hernias, bariatric, and gynecology. So coming to individual of that, hernia surgeries. So there are different types of hernias. Hernias could be right from inguinal region hernias to umbilical hernias to ventral hernias or incisional hernias, and there are certain missed hernias which can be picked up very easily on a laparoscopy, which are femoral hernias and obturator hernias. So what is the advantage? We are going to talk in especially about hernia surgeries doing in a laparoscopy when compared to open is that laparoscopic surgery gives a precision of what to operate, where exactly the tissue handling is done meticulously. There is less amount of tissue desiccation, less amount of bleeding, less amount of hematoma, and the post-operative time of recovery is always good, and the pain score post-operative is almost 70 to 82% better than open surgery, because open surgery deals with having an opening in the abdomen or opening at the wound site. In case of a hernia, you make it at the inguinal regions, or umbilical hernia, you make it at the umbilicus. In case of a laparoscopic surgery for a inguinal hernia, we do it with the standard 3-port technique with 10 over the supra umbilical region and 2 5 mm over the two lateral sides, higher or lower based on the side of it. We also do TEPP procedure for bilateral inguinal hernia repairs or a unilateral inguinal hernia repairs using a three standard port technique, which is a 10 mm and two 5 mm techniques, which are placed in the midline, not on the lateral sides. Coming to the ventral incisional hernia, it's called as the ETEP technique, which is also being done at our center. Alongside with that, we do the standard laparoscopic cholecystectomy procedures or laparoscopic appendectomy procedures or perforations of small bowels are also done using laparoscopic surgery. The other advantage of laparoscopic surgery over open surgery is that the patient uh, benefits from that particular surgery the way that his mental well-being is good. A patient doesn't have to come down, the stay in the hospital is less, doesn't have to come down often for his wound dressings or something. The chances of infections are less, the superficial infections or the skin infections are less. Now coming to other high-end surgeries of laparoscopic surgeries, so we do laparoscopic fundoplication for GERD and hiatus hernia. For that, we do using a standard 4-port technique, wherein we put supraumbilical port and two lateral ports over the anterior axillary line, and another port which is at the epigastrium, that can be used to retract the liver using a liver retractor or Nithasen's retractor, and to retract the omentum that can be placed a little bit more laterally. So that is the advantage of doing using the energy devices like harmonic or ligature, wherein the greater omentum is completely mobilized, and then up to the short gastrics, and then the fundal wrap can be done, which is a better way of operating using a laparoscopy than an open surgery. Now coming to the newer techniques of operating on a bariatric, the gold standard technique for a bariatric surgery is a laparoscopic surgery, because we should understand that these patients have good amount of thick abdomen. So when they have a good amount of thick abdomen, if you do an open surgery and you stitch or suture the anterior abdominal wall, there is always chances of burst abdomen, or there is chances of hematoma, there is chances of infection in the subcutaneous plane, and these patients take a lot of time to heal. So for the newer techniques, we have come with single incision surgeries for bariatric surgery. Single incision sleeve gastrectomy is done using a single port, which is called as the Sills port, which is placed at the umbilicus for super obese to moderate obese patients, as well as obese patients as well. That can also be done in another technique, which is called as a mini gastric bypass or a one anastomosis gastric bypass, which is also a modality of a bariatric surgery, which is performed at our center using a laparoscopic surgery technique. Now coming to other surgeries of gastrointestinal tract, we do the laparoscopic gastric bypass, which is a Roux-en-Y gastric bypass. We also do colonic surgeries, laparoscopic right hemicolectomy and laparoscopic left hemicolectomy for cancers involving the right colon and the left colon. Now coming to the gynecologic part, if there is a myoma, if there is a what do you call there are certain cysts in the ovary, so we do laparoscopic ovarian cystectomy, we do laparoscopic hysterectomies, we do myomectomies, and we also do ectopic pregnancy through laparoscope in case of emergencies, as well as a whole set of with a larger team of laparoscopic oncologists and laparoscopic GI surgeons. We do onco surgeries as well through a laparoscopy or a keyhole incision. So one should understand that laparoscopic surgery has totally revolutionized the field of surgery in terms of patients' outlook, patients' post-op recovery, patients' stay, patients' pain, and the long-term patient's benefit. in the patient's satisfaction compared to an open surgery. So with that, we conclude the session on laparoscopic surgery. This was a brief description about the surgeries which we perform, right from basic laparoscopy surgery to advanced laparoscopic surgery, which includes gastrointestinal surgery as well as oncosurgeries as well. Thank you.